World Hour, 9 to 10 p.m.
And you are listening to Africa World Hour, the Friday edition. Good evening to you. Thank you so much for joining us. If you've just joined us, 22 minutes to 10 as we wrap up the day's top stories. And now we talk about this matter as Southern Africa continues to face growing challenges in animal health. We talk about its production and collaboration across the region. That has never been more important. The Coordinated Union for Animal Health and Production in Southern Africa, or CUFAPH, recently held a regional meeting, and that meeting was to review progress and the shape of the way forward. We're joined now by Dr. Berhanu Bedane. He's the lead at the CUFAPH to unpack some of the key takeaways from the gathering. A very good evening to you, and thank you so much for joining us, Dr. Bedane.
Thank you very much for having me on your program.
So let's just first start with the gathering itself. What was behind it? What was the hope, the objectives of this particular meeting?
Well, the African office, Southern African office of FAO has different technical units, and one of those technical units is the coordination unit for animal production and health, as you mentioned. We call it CUFAPH. Maybe from now onwards, our listeners may get familiarized with that. So CUFAPH brings animal scientists, veterinarian biologists together to look into livestock issues, livestock development in Southern Africa. So this meeting was about looking back in the concluded year 2025 up to this moment, what we have done, and reflect on what is ahead of us, mainly looking into the main challenges facing livestock development in Southern Africa. So that was the intention of the 3-day meeting we had in Johannesburg.
And I see that one of the key focus areas has been the strengthening of technical skills and capacity building. In light of that, what are the major challenges that are facing particularly animal welfare in South Africa, Southern Africa, animal health and welfare?
Well, one of the major challenges we are facing right now is the increasing trend of animal diseases. We call them transboundary animal diseases. If you take the example of foot and mouth disease in South Africa, for example, it was something which was easily controlled in the past. But now the spread of foot and mouth disease in South Africa and other countries in the region is becoming really one of the major challenges. So the capacity of our members, the CUFAPH members, need to be sharpened so that they can detect early the occurrence of the disease. If it happens, how best we can investigate and conduct laboratory diagnosis, if you like, so that it can come under control. So for this, we need skills. And those skills, as I said, start with the recognition of the disease itself. In some countries, it has been, it was not there for so many years, 20 years, for example, in Eswatini, until recently when FMD occurred. So people who are the field personnel, laboratory personnel, do not know, they are not familiar with the disease. So the skill of recognizing it and properly diagnose it, and then the right way of controlling are really all very much needed, and that is where we are focusing most.
So in line with this, CUFAPH, I believe, is working on developing a new communication strategy. How long away will that go in creating visibility and highlighting the impact of these diseases and lack of understanding in some cases, or how better understanding can help improve the situation on the ground?
Two issues there. One is the awareness we are creating among the farmers, the rural community and those along the value chain, how to control this disease. So awareness creation is very important. Communication in general was one of the main topics of our discussion. If we work very hard, unless it is reported, unless it is communicated, it is as good as it never happened. So communication really is very important. Visibility is very important. And we took time to discuss about our capacity in communicating, creating visibility for our work, so that we are also fulfilling the accountability with the donor community. Most of our initiatives are financed by donors. So visibility is really very important, and we focused on that, on how best we can sharpen our skills in communicating effectively, how we can package our visibility materials and disseminate to larger audience. At the same time, the awareness creation at farmers level, as mentioned earlier, is very important for the community to get involved in the activities we are conducting in the field.
What other resources are you trying to mobilize for, if you're talking about improved integrated animal health and production efforts?
Resources, let me just point out that FAO is a technical agency and we are not donors. We rely mostly on goodwill of the financing community, the donor community, for most of our interventions at country level. What we are doing is one, preventing the occurrence of diseases, as I mentioned earlier. Before, it is much more effective and cost effective to prevent diseases from happening than trying to control, because that becomes now very, very expensive. So that is one area, disease prevention, and preventing disease starts with recognizing it as early as possible. Early warning is what we are calling it. And if it happens, quickly understand what that disease is, what its impact is, how best we can control it, and then respond to control it. So to control disease, you buy vaccine, you deploy personnel in the field to vaccinate against that disease. All these require resources, and we mobilize from different donors. For that, you have to have a very good visibility, what you are doing, how best donor money is used, accountability, and what impact it does among the community. So these all require a very good visibility and very good communication skills.
And having said that, do donor countries face different challenges and conditions to the countries for which they'd be mobilizing these resources for?
That is true, and it's a bit political as well. Not all donor communities would like to finance, across the board all the countries. So we at FAO have a skill in targeting which donors for what type of interventions. Because they are very much selective. Some of them wanted to work on certain areas, certain interventions, and that is a skill really, to see which donor has preference for which geographical area, for which type of interventions. One thing I would like to maybe bring up for our listeners is the shrinking or reduction in donor funding in recent months. Let me call it maybe from the start of the year. Donor community are mostly reducing their support specifically for African countries, and this is a new challenge we are facing. So we have to look into alternative ways of mobilizing resources, tapping to non-traditional way of accessing funding to finance our interventions.
Well, thank you so much for your time, and hopefully we'll get another opportunity to speak to you again, Dr. Berhanu Bedane, lead of the Coordination Union for Animal Health and Production in Southern Africa, CUFAPH, as he says. So we've learned a new word, a new term today. Thank you so much for speaking to us. And I hope to learn a little bit more from you and your organization and how you work together with the FAO. Well, that brings the time to just about 11 minutes to 10. We're going to wrap up the program in just a moment. And this time we're going to talk about youth affairs.